Thank you very much for having me. So hopefully what I'm going to be presenting on today is going to jive pretty well with what Dr. Alcon was presenting earlier about the autonomic nervous system. So what do we know about adversity? Well, research has shown that adversity has a tendency to get under the skin, and it has deleterious effects on various aspects of health, including physical disorders such as immune health and cardiovascular disease, as well as mental disorders such as schizophrenia and anxiety. It may be particularly hazardous if these adversities are experienced during critical windows of development. And one critical window of development that I'm interested in is early infancy. And when it comes to physiological sort of regulation, this is when we start to see some things becoming set in stone and we start to see changes, and it could be an important inflection point. So adversity experienced during this period of time may recalibrate certain set points at rest, which will directly impact the child's homeostasis and readiness to respond to stress later. But there's hope here. The flip side is that we do know that biological organisms, including humans, have an ability to adaptively calibrate to their physiology to their environment. And so this would include positive experiences as well. One positive experience that Dr. Alcon sort of illuminated on in her presentation that I'll keep going with is this idea of maternal sensitivity. Research has shown that maternal sensitivity is very important to the formation of physiological homeostasis in a baby. And it sets the foundation for more complex and social and emotional functioning thereafter. So it's a very important aspect of development. This is my best friend. She just had her baby last week. So I had to put a picture of her in here.
It's a new one.
Yeah, it's brand new. And so one way to look at the way that adversities or positive experiences like maternal sensitivity can get under the skin would be to look at biological systems such as the autonomic nervous system. And Dr. Alcon did a fantastic job of explaining RSA and PEP and the various aspects of this, so I'm not going to try to replicate that. But just to point out that we will be looking at both the parasympathetic and sympathetic nervous system in these analyses. And the parasympathetic nervous system, just to remind you, is going to be serving as sort of a vagal brake. So when it's on, it's going to decrease heart rate. And when the sympathetic nervous system gets turned on, it's going to be increasing heart rate. So it's more your fight or flight response. And the ways that we got at testing these two aspects of the autonomic nervous system is by indexing respiratory sinus arrhythmia and the pre-ejection period. And Dr. Alcon again did a great job of explaining those. And I want to put this in the context of the idea of it being part of a more general sort of stress response system. So the autonomic nervous system is just one aspect of this broader stress response system. And the stress response system overall is important for filtering and encoding environmental input, and encompasses both baseline and reactivity states. So I'm going to be focusing more today on the baseline state rather than the reactivity state, because it's been linked, especially resting autonomic nervous system, has been linked to various psychopathologies. I'm a clinical researcher, so clinical psychology, and so I tend to focus more on that, but it also sets the stage for reactivity in the future. So some research has shown if you have a higher baseline autonomic nervous system sort of functioning, that's going to blunt your reactivity later. So a higher or lower resting state is going to matter in terms of your openness to environmental inputs and your reactivity to those inputs. So my research questions were, does social economic adversity experienced at age 1 predict a trajectory of increased resting profiles of ANS reactivity, autonomic nervous system reactivity? Does maternal sensitivity experienced at age 1 predict a trajectory of decreased resting profiles, or more, which we would say is more adaptive for that baby or that child? And does maternal sensitivity buffer the effects of social economic adversity, causing a more tempered and adaptive profile of autonomic nervous system activity at rest? And so my hypotheses were that we would see these activation profiles. And so we would expect to see a higher activation profile at rest associated with the social economic adversity. So these kids are going to be a little bit more stressed at rest. And that maternal sensitivity at age 1 would predict a lower activation profile at rest, including these. And so again, our indices are going to be heart rate, HR, pre-ejection period, our sympathetic indicator, and our RSA, which is respiratory sinus arrhythmia, which is going to be your parasympathetic indicator. And finally, we hoped to see that maternal sensitivity would buffer the effects of social economic adversity on autonomic nervous system functioning. So the sample that I'm going to be ran these analyses with comes from the Chamacos sample. And so just to give a little bit of context about the sample, it's a half of this N, so we have an N of 601. About half, or a little bit more than half, come from a birth cohort. And then the other half came along a little bit later and were age matched to increase our N. But I'm going to be focusing on the birth cohort part of that. But just to give some context, 65% of these women had more than one child. They were recruited, by the way, prenatally, so when they were pregnant with their child, that's when they were recruited to be a part of the project. So we have a host of prenatal sort of indicators, and then the children have been followed every year to 2 years throughout their development. 85% of the mothers were born in Mexico, and it's a relatively poor sample, and so we saw that about 96% of the sample is living within the 200% of poverty level. Despite this, we do see some nice variability in our poverty levels, and so we were still able to use it as a predictor in our analyses. And it's primarily in sort of an agricultural setting. So we went ahead and we took the children from the birth cohort, and if the child had been put through an autonomic nervous system reactivity protocol at 1, 3.5, or 5 years of age, or hopefully multiple time points, then they were included in our analyses. But because we used hierarchical linear modeling, and I'll go through that in a second, we could include people that just came in for one of those 3 as well, those three time points. And then our index of social economic adversity included family income to poverty ratio, household crowding, and whether or not the family received food stamps. And the way that we came to this sort of index was we ran a PCA on a host of different poverty variables at age 1, and these 3 held together the best, and so we went ahead and moved forward with this as our index. And then we assessed for maternal sensitivity at age 1 by using the home observation for measurement of the environment. This is an observational measure. It also includes an interview with the mother that gets added in at different parts depending on what subscale you use. The subscale that we used was only observational. And so what's being observed is the dyad, so the mother and the child going about their normal day. And what gets coded is the amount, or whether or not it's observed that the mother is verbally responsive to the child, whether or not the mother is affectionate spontaneously with the child, things of that nature. And so there's 11 items that gets coded via the observation. Okay, and so there were also 2 different protocols that were administered that are sort of reliant on the child's age at the time. And so the first two time points were at 6 and 12 months. And this is the protocol that they were put through. And so before even the resting state was assessed, the mother and the child had time to acclimate to the setting and get used to the laboratory environment. And then they went through these different minutes of protocol. And so in order to get at the resting autonomic nervous system indicators, I just looked at the 2 minutes of rest. And I looked at the 2 minutes of rest at 12 months, and then the 2 minutes of rest again at 3 and at 5. And those were my 3 time points across time to look at trajectory. So for our analyses, I ran hierarchical linear models with the autonomic nervous system marker, heart rate, PEP, or RSA as the outcome. And that's being modeled by intercept and slope across time. B sub O is the intercept and B1 would be the slope. And then once we had a solid level 1 model for all 3 of our indicators, we went ahead and loaded on our predictors, which would be the social economic adversity, maternal sensitivity, and then an interaction of the two to see whether there's a buffering effect. As an aside, before we ran our primary analyses, we checked to see whether covariates had any sort of a significant effect on the base model. And so the 2 that we focused on were the child's sex and the mother's birth country. And neither of those were significant predictors, so we left them off the model for parsimony. Okay, so getting to results. In terms of trajectory, the main story here was that there were main effects for the slopes, but that the interaction was not significant for trajectory. But so we saw parts of our hypotheses being supported here. So for social economic adversity, we saw increased heart rate and reduced PEP. Both of those would be synonymous with an increased profile of rest and would be sort of more maladaptive. And then maternal sensitivity was predictive of increased heart rate. So that's going to be more vagal brake, which is going to be good, which is going to decrease heart rate, and increased PEP, which again is going to be a more restful sort of rest state. The interaction was significant on intercept, and so this is general level of activation, not taking into account that trajectory. And so what we did see was that the activation was significantly, or the interaction was significantly related to the heart rate activation and RSA activation. And so to get further into what that meant, I went ahead and made some figures. And so what we have here, I did this for all 3 predictors, or all 3 autonomic nervous system indicators. And so what we have here is I used the regression model from the hierarchical linear modeling and went ahead and plugged in values 2 standard deviations above and below the mean on the poverty and the maternal sensitivity index in the interaction. And this is what we found. So quickly, just to point out, the top and the top and the bottom lines are both high poverty sampled or groups. And what's differentiating these 2 groups is the amount of sensitivity that the child experienced at age 1. And so the highest group right here, the highest line, that would be the most maladaptive line. And that's associated with the high poverty and low sensitivity at age 1. So again, they're having the most maladaptive profile for heart rate. And the lowest line is also high poverty, but they had the high sensitivity. So those children are more at rest across time than the ones that did not have the sensitivity. And the 2 lines in the middle were both low poverty groups. We see pretty much the exact same thing for RSA. So the top and bottom lines are the high poverty groups, and what's differentiating them is the amount of sensitivity. So the highest line would be the most adaptive. That's a high profile or high poverty, high sensitivity group, and the lowest is high poverty and low sensitivity. And then again, the 2 middle ones are low poverty. And for pre-ejection period, we see that again the most maladaptive group would be the one at the very bottom, and that one is high poverty, low sensitivity, and I guess I could point here. And this line right here is where we see the other high poverty group, and this high poverty group is high poverty, high sensitivity. So just to wrap it up, bottom line, socioeconomic adversity does predict more ANS activation over time, and so these kids are their hearts are under more stress at rest. And maternal sensitivity is predicting less activation over time, so they're experiencing less stress at rest. And at least for activation, not looking at trajectory, but just general activation, it does seem that there is a buffering effect for maternal sensitivity, which is great. I mean, it kind of gives some hope. And so the results are highlighting the importance of family dynamics, in particular maternal sensitivity, age 1, and buffering those deleterious effects. And points to a potential treatment target for families living in economically disadvantaged circumstances and settings. And being a clinician, this gives me as a therapist also some hope, because if I am there to intervene with the clients to help foster warm and sensitive interactions at early ages, I think that could give the family some hope as well. Vagal tone in particular may be particularly impacted by environmental input at age 1. That was the one interaction that was truly significant, and heart rate was just trending. So it seems that increased poverty coupled with increased maternal sensitivity is going to be leading to increased resting RSA, so more break, which is going to be good. And high poverty plus low maternal sensitivity is going to be leading to lower resting RSA, which is going to be bad. So the take home is that maternal sensitivity is particularly important in the context of poverty, and in particular may be linked to that parasympathetic profile. And so the main effects were there for the trajectories. So we're seeing upregulation associated with the social economic adversity and downregulation associated with the maternal sensitivity. So those kids are going to be more relaxed at rest, which is what we would hope we would see. A couple of limitations. This is an ethnically homogeneous sample of Mexican American children and mothers who are living in moderate to extreme poverty. It'd be interesting to see whether this replicates in other sort of samples as well. And then we did not model chronic poverty or maternal sensitivity across time, which would also be very interesting. We just looked at the age 1. So the implications are that young children need emotional support from adults, especially for children who are growing up in poor families. And adversities experienced in life can get under the skin and impact life course later, such as during adolescence or adulthood. And here's my little 1-year-old. Thank you.
Sensitivity is very important, so I think, is it possible to early change maternal sensitivity?
Yeah, I mean, there are different therapy techniques. So like behavioral parent training, one of the large components of that is, even before you start trying to sort of modify child behavior, is to foster that warm interaction style between the mother and the child. So like scheduled playtimes that are like particular to the mom and the child, and it's just between them. And what you can do during that time is sort of coach the mother on like how to verbally even just what do they say? Just like be the coach or something, or in that way, and I mean just descriptively saying, oh, and now she hands me the ball, and now she's gonna color a picture, and I mean just like even commenting like that, and sort of being the play-by-play person, and fostering that relationship between the mom and coaching the mom on how to do that. That's one way to definitely intervene in something like this. So I could see, that there would be ways to intervene and foster that, for sure, therapeutically. Mm-hmm.
And I was going to add some more to what you know and you're really familiar with is empathy building among teenage moms with their kids, and so having them make narratives for the babies so that they better understand them.
Yeah, definitely. Mm-hmm.
I'm a psychiatrist, so I have a bias, but I'm curious about the relationship with depression and maternal sensitivity and how you approach that. How do you think about
Yes. Okay, so yeah, that's such a great question. So we ran these same models with maternal depression at age 1, and that actually is what led to these analyses. So we saw the inverse effect. So rather than maternal sensitivity sort of helping the profile, maternal depression hurt the profiles across time. So we saw the opposite effect. It was like a double whammy.
And
so
are the moms who are most depressed also less sensitive in general?
that I imagine that would be the mechanism, but we didn't actually look at that. I think that would be, we have all the variables to actually look at that. So I think that would be something very, very useful to look at for sure. Yeah. Yeah.
Excuse me, I'm coming from Costa Rica, I'm pediatrician. So, do you have any investigation or research about early bonding or early attachment in relation with sensitivity in mothers and in children?
Yeah, in this sample, we don't have attachment styles coded of any sort, but that's really very interesting to me too. And I come from a line of studying externalizing disorders later, and which brings me to the earlier time point of wanting to understand temperament, attachment, goodness of fit, and things of that nature during this period of time, which can, change these trajectories and be a switch point. So I agree, it's super important, but we don't have that actual variable in this data set. Yeah.
Thank you.
Mm-hmm. Yeah.
Ask about the role of other caregivers or fathers or family members.
Yeah, I wasn't able to actually look at that in this data set either, but I think there are studies that talk about general parental sort of warmness and including the father in that. Actually, father absence is something we're also very interested in because that has a deleterious effect at certain time points as well. And so, yeah, I think these results would most likely extend to parental caregivers and or just caregivers in general, and having that warm relationship fostered to sort of mitigate the effects of living in poor circumstances. Yeah. Sorry. Good. Yeah.
This is more of just a curiosity thing. When you were talking about the variables that you were testing individually, you mentioned the sex of the baby, and then you also mentioned the country of birth of the mother, I believe.
Mm-hmm.
I was just curious as to how that would be related to the picture in general.
That's a really good question. I think I included it more because I was curious myself.
Okay.
And because we had 15% of the moms that weren't Mexican born, I didn't want to have these two different samples of have that potentially cloud my effects. But I wasn't quite clear on how, and maybe Dr. Elko would know, but I'm not quite clear on how it would differ myself on autonomic function. Yeah. Sure.
Okay.
Thank you.